And you're with Around the Northwest. Now, there's a new private ultrasound clinic that's opened in Derry, and it means that you can self-refer, for want of a better description. And it's Gerard McCrossan who's opened it. It's called Ultrasound Scan Clinic, and it's what it provides really is on-demand scans. And Gerard now joins me in the studio. Gerard, this is a wee bit unusual in that you don't have to go through a doctor or a consultant if you want an ultrasound for whatever reason. Call you up and make an appointment.
Yes, that is correct.
All right, simple as that. Now, what would most of your scans be for? Would it be women who are pregnant?
Yeah, largely about 80% of the clientele are obstetric patients, which are pregnancy-related scans. Okay. That's ranging from all aspects of pregnancy and largely offering reassurance. As you know, the NHS and HSE appointments, there's a fair bit of waiting lists there. Yeah. People that want instant reassurance. Sometimes it's not always good news, but majority of the time it is, and that reassurance can count for a lot. They can come in as and when required and see the baby on screen, so to speak, okay. And that can mean a lot. And that can also be health scans as well.
And it could be even in between appointments because they might be a bit stretched out with the HSE or wherever.
That's very much so, yes. A lot of our early pregnancy scans, and that can range from people that have had maybe a complication in a previous pregnancy, or just want general reassurance, one, excluding ectopic pregnancy for baby and obviously mother's well-being. Some people really like to know if it's potentially twins.
Yes.
And then just further planning down the line. Some people with maybe irregular cycles don't actually know how far along pregnant they are, and it can also be that reassurance as well, so they have time-convenient scans thereafter.
Right. From memory with the HSE, partners allowed in for a scan, and I'm guessing it's the same with NHS, but it's a wee bit different with you.
With ourselves, yes. So any sensitive examination, we do recommend only bringing themselves and potentially their partner or whoever else with them. But for other scans, it's particularly nice for. We do also offer scans that are of a less serious nature, and it's becoming very popular is gender scanning and 4D scanning, and those can be seen as a bonding experience, and it's particularly nice for those that have older siblings or grandparents or whoever it may be, for the obvious reasons.
So to find out if it's a boy or a girl.
There's that is becoming very popular, yes.
Okay.
But particularly older siblings as well can feel involved coming from any scan, a dating scan thereafter, seeing baby and feeling involved with it as well.
Okay. And what's ultrascanned particularly? I mean, we think like something to do with bones, we think an X-ray. What is ultrasound particularly good at?
I'm very glad you've asked that. It is particularly, it's a fantastic diagnostic tool on solid abdominal organs. So primarily your liver, gallbladder, kidneys, pancreas, biliary tree, common duct, and spleen, prostate, and male testes as well. Okay. We would get a lot of queries regarding bowel and stomach. Unfortunately, any organ that contains air isn't well appreciated under ultrasound. So the bowel and stomach isn't well appreciated under ultrasound, but okay. Those organs mentioned really are.
Now, you worked at Alton Galvin. You were known as, I think, the scan man there. And so plenty of experience. But how does it work then? Do you send a report then to the doctor or the person who's the scan?
Yeah, so anyone coming to yourself, we offer longer than conventional appointment times, and that's to get a background medical information, have a talk what their concern is, it a family history or what their complaint is, and then there's a scan and it's discussed. They can see the scan on screen as well when we go through, so explaining what we're scanning, why we're scanning it, what we want to see, and obviously things that we don't want to see.
Right.
So we discuss then findings as well as a hard copy. If everything is looking ultrasonically how it should, that gives reassurance that things are how they should be. If something significant is identified, a report is created, given digitally and hard copy, and then that is taken then to a medical referral it expedites the process, hopefully not, but if someone were to have a testicular tumour or a renal tumour, they would go back to their healthcare provider then. They've been scanned by a registered and qualified medical professional, and that would expedite the onward referral to urology or wherever they would need to be.
Okay, that would hopefully speed things up.
One, they don't have to wait, not so much maybe in the south here, but in the NHS it can be problematic getting a GP appointment and then being referred for an appointment, so it expedites that process. And if it is something significant, we all know time is of the essence. So
absolutely. And what's the cost? I mean, if I want just, let's say I'm concerned about a prostate or something and I want to get a scan, what's the cost?
So abdominal scan, which is the most comprehensive one, that's £140 sterling.
Right.
A renal scan, that includes both kidneys, the urinary bladder, is £110 for females, and because it is the added assessment of prostate in males, it's £120. And then a male testicular scan is also £120 as well.
Okay. And what would be the waiting time if I've, likely to be seen the same week or get a scan the same week?
Certainly seen the same week. We are certainly getting busier, which is not a complaint, but it's still been held within the same week. As we're becoming more established, our opening hours are expanding, and that will keep waiting lists down as well.
And what's the response been like from, GPs and hospitals?
So when I initially started this out, it is getting much more positive. On note, in City Centre of Derry, I went to one GP practice as it was about just before Christmas, and they asked me where was I 3 or 4 months previous. I think there was a few incidents of waiting lists and things like that.
Yeah.
They think it's fantastic. The way they recommend it is they don't obviously enforce it on anyone. They will still go through the conventional NHS Trust Services referral.
Yeah. But
for anyone that is particularly maybe anxious, can't or won't wait, or whatever the reason be, they're letting them know that our services are available.
Okay, so they can't make an appointment for the person, but they can suggest that, listen, if you want to get it done quicker, then
yes,
here's an alternative.
Indeed.
Okay.
And just to point out, if someone comes to ourselves and it is a significant finding, there is the possibility they will still be referred into the trust for the same scan, but it will be expedited because it's already been scanned, identified, and they may want to have it on record. The images are there and provided, but they're not basically conclusive, as in they don't put them onto the NHS records. So they will be probably referred, but at a much faster rate.
Okay, and with so many things, speed is of the essence. The quicker that someone can be scanned, and then the results of those scans analysed, and hopefully treatment given, the better.
Indeed,
the better the outcome.
Mm-hmm.
Yeah. Okay, it's ScanMan, same day ultrasound scanning service, and it's available in Derry online. What's the website?
www.ultrasoundscanclinic.com.
Okay, and whereabouts in Derry are you based?
Clarendon Street.
Okay.
And I just want to make it, we're a first floor premises as well. We do envisage down the line hopefully having a ground floor premises, but unfortunately there's no wheelchair access at present. I want to make that aware.
Okay, that is all good. Gerard, thanks a million. Putting us straight on that. Thank you.
Thank you for having me.